How would you prescribe your personal philosophy on aging well? Can anti-aging and natural aging coexist, or are they at odds?
Skin quality have the four categories, emerging perceptual categories: skin firmness, skin glow, skin tone evenness, skin surface evenness. This is the four categories that we have to always mark to know how to start, and that is our starting point.
I would love to hear about your approach to facial balancing and volume restoration in a way that preserves the identity instead of just reshaping everything and putting, things where volume is lost.
I'm very old-fashioned dermatologist, I can say. I don't like quick fix. I think the fashion is nice. You have to do the quick fix, but I'm in love with many procedures. I can say procedure per the level of the skin. I always like to combine them, and I like cooking. More you cook, you have better, meals.
If you've ever been curious about Botox, filler, or those real secrets behind those effortlessly snatched celebrity faces, this episode is for you. Today, we're joined by internationally renowned dermatologist and aesthetic expert, Dr. Radmila Lukian, the woman behind some of the most natural-looking transformations in the world of beauty.
We're going deep on everything from filler fatigue to preventative Botox to red flags you need to look out for before letting anyone near your face with a needle. Dr. Lukian shares her candid thoughts on what's worth your time, what to avoid, and how to age gracefully if that's your vibe.
Yes, so whether you're needle curious, already on your injectables journey, or just love knowing what the skincare elite are doing behind the scenes, this episode will leave you feeling informed, empowered, and way more confident in your choices.
Oh, okay. So before we start, where's Lindsey and Mamina?
That's a great question.
I think she's having a lot of fun without us in Mexico City.
Yes, I know. That's the thing. There's one of us is usually traveling or some kind of thing.
Taking care of kids, taking them to appointments, doing some sort of social media content, working in clinic.
Right.
So there's always
I mean, it's honestly a miracle when it's like the three of us here. But that's usually the goal. The goal is to have three of us. But we hope Lindsey, we miss her. We hope she's having a lot of fun doing something worth her while. I'm sure she is.
But with Lindsey not being here, we have room for such an exciting guest today. Can't wait to pick her brains on all the making just everyone beautiful in the world, all the beautiful people more beautiful.
Yes, a very highly sought after international dermatologist who's treated some faces that you've probably recognized.
And it's been in the news. Yes.
Yep. Dr. Lukian, thank you so much for joining us today. We are so excited to have you here.
My pleasure is to be with you today. Hello from Dubai.
It's not too long ago that we've met in person in Monaco, right? So Mamina and I, it was such a pleasure meeting you, sitting across from you, having that short time where we could chit chat for a little bit. It was amazing. So honored that you can come on our show and chat about skincare and cosmetic dermatology. We definitely want to pick your brains.
I'm happy always to share my experience and with my dear colleagues from that far away from away. And being in Dubai we have similar international crowd around us as a patient. They have many things in common, but I really like my world of dermatologist.
Wonderful. And yes, being that you're in Dubai, I think that you also share a different perspective and have different experiences. So I think this is going to be so valuable for our listeners to hear the kind of perspective that you can share just from your experience practicing in a completely different part of the world. So yes, we're going to get right into it. The first part, we're asking kind of some quick questions. You don't have to give super long answers. It's kind of more fun questions and just to see what your thoughts are.
Yeah, more like rapid fire, just quick response.
Yes.
Okay. Yes. I like that. Let's go quick and fast.
Yes, all right. Okay. So do you believe there is such a thing as skin fasting or cycling products?
Yes, I do, because we have to always break our routine, and in order not to have saturated receptors in the skin with the same creams. I really like cycles. I like always to advise my patient to do it.
And
Nice.
can I ask, what are your personal favorite things to cycle?
I like always to cycle and to change the routine with new products. Like I like always when now we came back from Monaco, I brought so many new products to change because there might
Yeah.
be a dermatologist like always to try. Then there is no my favorite cycle. I am always in cycle trying the new products before I will, place them and recommend them to my patients.
Love that.
Yeah.
Love that.
So, there's always new products coming out every year. Are there any anti-aging skincare ingredients that you think are worth the hype in 2025?
Yes, I think epigenetics is the new era of skincare,
Oh,
and the
yeah.
new controlling the epigenetics damage in the level of the skin is something that I really am so excited because the dermatology is now all about regenerative dermatology and regenerative aesthetics. Yes, definitely
Yes.
25th will be exciting.
Yeah, it's
Nice.
very exciting time in our field right now. Okay, moving on. What is the biggest skincare mistake you see people make that is actually aging them faster?
Uh, Yes, I can see in our area where I'm practicing in Dubai, people they don't like to apply sunscreen. I think it's one of the biggest
Yeah.
mistake.
Yep.
And the other ones is using so much products unapplicable for the age, unapplicable for skin condition, and I think it's the biggest mistake.
Yeah.
That makes sense. Yeah,
Yeah.
I feel like the biggest mistake we see too.
Yeah, for sure.
Okay, so what is the number one simplest thing that we can start doing to reverse fine lines and wrinkles?
Everything what will improve the skin quality, starting from skin routine. We mentioned a lot about skincare, yes, skincare, but the lifestyle 360 approach is the very important. Today we are talking about holistic approach to skin. I think our lifestyle is very important to consider and contribute to that. Now, as dermatologist, I can see how important is to understand the patients, how they live, what they do, and environmental atmosphere and damage to consider how to start and what to use first.
I love
Yeah, I think
that.
that's huge. I think we need more education too. I don't think we get enough in the US. I think we're starting to get more, but and we're getting more awareness of it, but I think that this is a huge topic and I love that
Yes,
you're interested in it.
yes, it's a really huge topic and many things to implement in the offices daily, and I'm excited about. I really like
Yeah.
implementing the new era of anti-aging with the artificial
Yeah.
intelligence, for example.
Oh, yeah, there's that whole field too.
Yeah,
Yep.
yeah. So speaking of clinic and procedures and what you like to implement, what is one treatment you think people really need but actually aren't getting done?
I think there is no one treatment.
Mm.
There is no magic treatment. Everybody likes to say what is the one treatment suitable for everyone, for every type of skin, every age. I think also social media really promotes this kind of the fame about one treatment. We know this is a combination of the treatments. We are dermatologists.
Totally.
We like to treat the skin from A to Z, from the deepest layer to the surface. And I would like to say combination of the treatments is always a key of successful treatment. And this is what I
Nice.
like to promote, and this is my philosophy and my approach.
Yeah, no, I love
Yeah.
that. I think you are absolutely right. We always get asked, and we're asking you the same question, but we always get asked, like, what is one best thing? What is one best product? And it's so personal too, depending on your goals, your age, your skin type, and all the things around you and how you age. So I love that it's very much a customized treatment, and everybody's different. Yeah, love that.
Yeah, I think personalized treatment is something that we learn from our patients every day, how we have to be very creative and how we have to be very knowledgeable and how you have to understand your industry and you to understand and to learn. You came from US to Monaco, I came from Dubai. Next trip, I hope you will come back to US. You come to me in Dubai. We
Yeah.
like to share, and
Yes.
because we
Yeah.
have to always consider difference in the also in the aesthetic. There is different due to ethnicity, type of the skin,
Mm-hmm.
parameters of
Mm-hmm.
the beauty when we talk about the beauty. But I
Yeah.
think today globally we are talking about well-being and how to implement
Yeah.
in each field, especially
Yeah.
now dermatology field.
Yeah. So
Yeah.
I just want to pick your brain. Is there one treatment or procedure yet that you personally just like to perform for whatever reason? No. Whether it's just like it's fast or it gives great results, just you personally like you like to do.
I'm not. I don't like quick results. I'm not a person.
Yeah.
I'm very old-fashioned dermatologist. I can say I don't like quick fix. I think
Mm.
the fashion is nice. You have to do the quick fix, but I'm
Mm-hmm.
in love with many procedures. I don't. I can
Yeah.
say procedure per the level of the skin. I always like
Yeah.
to combine them. Then I like cooking.
Yeah.
More you cook, you have better, meal.
Yeah.
And I
Yeah,
always find
exactly.
or you to create the best perfume for each kind of the skin. The perfume has smelled differently. It's like I find myself. Then I can't prioritize something, but honestly, I develop some special skills on non-invasive facial
Mm.
tightening, lifting. I
Mm.
might say I do this very well, and comparing with my results are
Mm-hmm.
very different. And as we are dermatologists, this I'm proud
Hmm.
to say, because 18 years back
Mm-hmm.
when I
Hmm.
started to implement them, I was pioneer in the market, and speaking and talking to many conferences in front of the plastic surgeons. I seen how they've been very skeptical about my results and about what I'm talking
Mm.
about. But nowadays, using all of them in my practice, I can find and use know how to combine with all procedures, because as I really like always to underline, we are dermatologists, we are very strong
Yeah.
about skin quality, then you can
Mm-hmm.
Hmm.
have really outstanding results.
Yeah.
Yeah, that totally makes sense. I know it makes me want to go to Dubai and get treatment from you.
I
Um,
know.
but I know that, and like as we all like to practice, it takes like a series. It's not just like a one
Mm-hmm.
time thing. You have to like it's multiple treatments over the course of a period of time,
Mm-hmm.
indefinitely, really.
Yeah.
Okay, well, we're going to kind of move on to talk next about just kind of your sort of aging aesthetics
Mm-hmm.
philosophy, the way you approach it. It seems like you kind of touched on it, but we have a
Mm-hmm.
couple more specific questions. So, other question that we have is: so you built a reputation around natural, elegant results. How would you prescribe your personal philosophy on aging well? Can anti-aging and natural aging coexist, or are they at odds? How do we like feel natural but also still like keep maintaining like natural, like youthful results?
Yeah.
One of my lovely friend and celebrity, she said once when she visited me, I don't really mind aging, but I wanna learn
Mm-hmm.
like aging well. I think
Hmm.
this
Yeah.
the
Hmm.
philosophy of our, my concept and our vision as dermatologists. We like to care about skin. I'm very passionate about the
Mm-hmm.
skin, and I think recipe is a journey. It's not like
Yeah.
quick fix, or there is no one single treatment. And this is what I like always to educate and advise my patients and my
Mm-hmm.
audience, that we have to consider celebrities are trendsetters. We like them
Hmm.
when they're promoting aging well, and they are an
Yeah.
Mm-hmm.
example about it. And I really honor to have them around me and to be with my clinic, because this is what I like to send to audience. Aging, chronological age is something we cannot stop, but biological
Hmm.
age truly depends of our skin appearance. And this is our
Mm-hmm.
area that we can address so many treatments, and
Yeah.
with the very strong knowledge and experience. And we know that we can stop biological aging, and appearance on the skin can be very well controlled today. We have powerful treatments, we have powerful products, we have biostimulating products, we have
Mm-hmm.
anti-aging products, and creating the journey. This is something that is really, as you mentioned previously, personalized, tailor-made. And in this journey, you have to have trust. The patient has to be really committed to you, to stick with some concept. And its philosophy, as I said, I like multi-layer approach. You have to consider that skin is always showing the sign of aging on underlying structure like bones, muscles, fat, deposits, and then you have to check each layer of the skin where the aging is attack the person, and you have to know very well your patient and how to start and how to have the vision where you are going through. I always like to say you have to recognize the youth of the person and to take this youth out, because for me this is so important. You have the vision how the patient's skin should look like, and I like always to start with the most the weak point to get the maximum improvement.
Yeah. I think
Nice.
it's so important to have, like you mentioned, that good skin quality. It really does significantly improve one's, appearance and that youthfulness. And I love your approach too, which is why I think the results are so natural the way you do it, because you're not trying to reverse. You're just trying to, like you said, age more gracefully. I feel like, at least in the US, I'm not sure if it's the same in Dubai, but there's been kind of almost this fear around fillers. And I think it's more people are seeing, like, maybe overdone or, having migration, etc. I would love to hear your, suggestions and tips when it comes to like Botox and fillers. What is your guiding approach? Like, do you view these as tools for prevention, corrective, or something else entirely?
Talking about Botox and fillers, I can say they're almost in the end of my protocols.
Oh, yeah.
I like to implement them in the
Interesting.
practice, but
Hmm.
I'm more
Yeah.
as a preventative tools, especially Botox.
Uh,
I don't like to use them for like to start as a starting point. As dermatologist, as I
Mm,
said, I'm old-fashioned dermatologist. I like to work a lot on the skin condition, and
yeah.
the skin, as you said, skin quality have the four categories, emerging
Hmm.
perceptual categories: skin firmness, skin glow, skin tone evenness, skin surface evenness. This is the four categories that we have to always mark to know how to start and where is our starting point. There are many publications about those categories, and now we know exactly that Botox and fillers are uh, there, but not like the first line. And I always been like that. I always kept them in the last line when you start, and you do all the four parameters. You treat them at the maximum. Then you use Botox and fillers in the very safe manner, especially fillers, and you use in the um, very small low doses. My approach is always less is more, and
Mm,
love
only if
that.
is
Yeah.
necessarily to
Hmm.
use them in some areas of the face, and you
mm.
find that really you need them. I really will use like neuromodulators. You cannot replace them for some expression lines.
Hmm.
That's a wonderful
Okay.
approach. Yeah, I love
Yeah.
that. Hmm.
All right. And then speaking of injectables, the idea of starting young with injectables, is everywhere. So what's your perspective? A lot of people, just young people, are getting it to prevent wrinkles
Hmm.
at a really young age, like people in their 20s. So
Hmm.
people call it preventative Botox or baby Botox. So how do you decide what's truly right for a patient at any age?
I don't know in US, but in our Middle East area, GCC area, Dubai, where I'm practicing, Generation Z is really crazy about Botox and fillers, and we are sometimes surrounded with the new patients asking, and they are keen to do Botox in early age. And
Yeah.
I really like to always check the skin condition, as I mentioned,
Mm,
and I find myself more educating those kind of the
mm,
patient and younger generation about skin condition and skin routine. Sometimes my consultation is adding only with the skin care, but
Mm.
sometimes you need to use baby Botox or less number of units
yeah.
of Botox to correct some expression lines, because obviously you have some younger patients exercising, frowning a lot and being
Yeah.
exposed to sun, frowning a lot. Yes, I have to consider, you have to know the borderline when you should say no to the patients, and you have to address age-related procedures. In Dubai, we do injectables above the 21 years age, and the patients strictly should see the doctor, not the nurses. As I know in US, they can be injected by nurses, but here the law is very strong, and I'm really happy to be here for that, because you really can put strong line where is yes, where is no as a doctor.
Yeah. Okay. So sorry, you said that in Dubai that only doctors can do injectables?
Yes, yes.
Wow. Okay. Okay.
That's, yeah.
That's probably for the better.
Yeah.
I find,
Because I know there's,
it's
Yeah.
much better, because in early age they will be seen by doctor, and I like always to say, once you have the new generation patient, and you're so exciting when you're the first doctor with whom they ever did the Botox, and then you educate them. For them, this is the new vocabulary, new world, and then you will get the trust of the patient, and this is something that is so exciting. So exciting,
Yeah.
but as I said, we are dermatologists, and always being doctor first in aesthetic medicine is very important. Sometimes you have to know to say no.
Exactly. I love that, because I mean, I have patients coming in and they want to like treat their brown spots and their wrinkles, but they have all this acne on their face. And I was like, let's treat the acne first. You're getting all these dark spots because of the acne. And so yeah, like it helps having that training and focusing, like you said, on the skin and addressing like the medical issues first, because then that's going to only help with the cosmetic aspect. So yeah.
So I assume like medicals or those spas don't exist in Dubai. It's quite popular here in the US, where you have these kind of aesthetic medical spas, but really aren't housed or staffed by doctors. And they do a lot of treatments, all the way from probably injectables, depending, to lasers, to peels. But it sounds like in Dubai, any sort of aesthetic clinic is really doctors who are at the kind of the forefront of. That's great. Yeah.
That's great.
Because I think aside from the results, it's really the complications too that we worry about, as you know, that can be very tricky, that may not always be as easy to manage. So okay, we want to pick your brains a little bit more about fillers, as we talked about. It sounds like it's definitely a very important tool for the right person. And I feel like in the US here, maybe blamed for creating this kind of cookie cutter face. I know that like in China, it's, where I'm from, I see a lot of social media there, and it's very much, they have a certain way of creating this look that almost makes it hard to, like, everybody looks very similar. I'll just put it that way. So I would love to hear about your approach to facial balancing and volume restoration in a way that preserves the identity, instead of just reshaping everything and putting, things where volume is lost. Like, basically love to hear your approach on how you, that approach to fillers on your patients. Yeah.
As you mentioned before, was even slang pillow face, and we had patient come, remember, and the patient used to come in the office, been injecting with many doctors with different products that even didn't were aware about which product been injected, and latest publication shows that MRI proved that fillers can last even more than 7-10 years, especially in the area like under eyes area. And this makes really, as you mentioned, some kind of unwanted results for the patient. Even fillers can migrate, and having these kind of patients, they are searching and they're keen to listen to the doctor advice about dissolving the fillers. As we mentioned, complications sometimes, injecting the fillers in the improper level, and using improper fillers density for some indication, like using the fillers which is supposed to be used for the cheeks, using for the lip fillers. One moment in our area was a trend, Russian lips, and the patient used to come with, very
Oh,
big
right,
lips
Russian.
injected with
Yeah.
volumizing fillers.
Oh.
Having all of that, I find it is the most difficult job when you have to correct someone. What was not done properly or not done on the way how it's supposed to be done, because anatomy is very important. The respect of anatomy, talking about fillers, is number one for the safety and also for aesthetical effect. And correcting mistakes is the most difficult job for us doctors, I believe, in US and is here. And sometimes you have to dissolve all injected fillers. And I'm happy that today we have more and more biostimulating products in our hands, and I think the fashion of the fillers is going to this direction. And having a possibility that you can stimulate your skin to produce your own hyaluronic acid, and you can have a beautiful outcome without injecting hyaluronic acid fillers. It's amazing, because there is nothing better than to get your own production if you know how to inject and how to use it. And I'm more and more in this direction, using the other products rather than fillers, keeping the fillers only and the last, and my protocols in the unnecessary replacement volume. We have in Dubai, I think, all over in the world, we have situation the patient has dramatically lost the weight, and then you have to have fillers replacement for the volume. Then you use a bit higher concentration and high quantity of the fillers, but these are very exceptional cases.
Yeah.
Off topic, is Skin Booster really popular in Dubai? Because we certainly hear a lot in Asia, and I feel like it's very trending here in the US.
I can say yes, we are exposed to sun 12 months per year. Then patients really are happy to inject the skin boosters. I've been injecting skin boosters since the first day the company Restylane launched. I was, I think, the first one who participated in launching. I'm like history of the skin booster, and it's one of my favorite treatments. When you ask me, I like this fashion.
Yeah, no, that's great. Yeah, we just wish we had more products available in the US.
Yeah,
We have
we
very
don't really.
limited selection, as you know.
We have
Yeah,
one skin
so.
booster from Allergan. But yeah, just for the listeners out there, just to clarify, but when Dr. Lukian refers to biostimulators in the US, we have biostimulators like Sculptra or Radiesse. So those are the things that you can inject. Okay, great. So, and then the hyaluronic acid fillers are, what people more traditionally think about with fillers like Juvederm, Restylane. Yes. All right. So do you think that sometimes if people get Botox or filler, do you think that it can actually age you faster if it's overdone or placed incorrectly? And if so, like, how do you prevent something like that from happening?
I definitely seen in my practice patient looking older with being over injected. I don't know you there, but me too.
Same. Yes, same.
You can see how the youth is gone somewhere, and the patient, they don't look themselves.
Exactly.
And I think actually what we do, the dermatologists are trendsetters. We have to really talk and to have awareness about how the fillers has to be applied, how we have to respect anatomy, as I mentioned, and how we can beautifully use the other products rather than the fillers. Let's keep the fillers as the one of the option if the others are not will be successful. And I think this is the way how we will prevent this over-injected phases. And one other things what I do in the office, in the clinical practice, I'm very big lover of devices. I like to use many different lasers, radio frequency devices, ultrasound-based devices to tie to firm the skin to improve the skin quality in the highest level. Then you will need a very small quantity of the fillers if you know how to beautifully use to stimulate the skin to produce collagen elastin. I think this is the one of preventative tools how to escape overdone face with the fillers.
Love that.
That's great. Yeah.
That's so, it's really nice to hear. And I think that's why the results that you get, that you do is so looks amazing and natural. So, kind of going back to the fillers again, feel like there's a lot of focus on like cheeks, lips, or jawline. Is there one area that you feel like we don't talk about, but can really elevate results and can make a huge difference that's underrated or overlooked when we are talking about like, kind of enhancing that facial harmony with age?
I don't believe there is one certain area should be more important than other of the face. I like, as you said, when we balance and harmony on the face, we have to have full face approach. And every patient is different, as we discussed, and we have to tailor-made the products and the protocols, what we are going to do. And I'm totally agree with you. Sometimes the small correction of the small tiny things that the patients are bothered makes them more happy and more confident. But having the full face approach, we know that balancing the face is not only per area, because I know that before was a trend. I never liked to follow the trend, like model look cheeks, special shape of the lips, clarified jawline, but we know that there is some standard and beauty parameters that we have to always follow and to guideline the patient and to direct our treatments and protocols to achieve the best harmony. In the end, this is what makes the person beauty. And you have to get personalized beauty and to improve in the maximum level, not to change the person, because the fillers can be big, powerful in this direction, as we mentioned about overcorrection. And we have, my approach is always not to change, to keep the and preserve the natural beauty. If you can enhance something, what the patient likes to be enhanced, because sometimes we have the different approach about the beauty. In Dubai, we have the different beauty standards. We have people from all over the world, and parameters and standards of the beauty is something that we have to we can discuss one more podcast.
Yeah, gosh, I know there are so many different standards. Like, even like within the U.S., if you go to one coast, people look a certain way, and the other coast, people look a different way too. Yeah. So I know you have a lot of different clients, celebrity patients. I think you really look at people, with scrutiny. And how do you help your patients, whether they're celebrities or not, look refreshed and confident without ever appearing done? And you probably already touched on this, but if you don't mind just sharing, your principles that guide that balance of making them feel refreshed and confident, but also looking like they haven't had anything done or without looking overdone.
I like to treat all my patients as they are celebrities, because there is no difference actually. But you have I always consider I always think if I'm in front of myself, what this skin needs, what I can do the best. I have always this kind of the question to me, asking myself and challenging myself for each patient, what I can do the best in the safe manner to get the best from the skin and the guest, to get the best in order to implement all my knowledge about anti-aging, preventing the sign of aging, because as I mentioned, biological age is something that we can somehow control today. And as we can see, I mentioned celebrities, but most of them, they are in age. They are not anymore younger, and they are still beautiful, and they have youth. And this is something that We have what I do. I like, as I mentioned, to combine. You cannot stick to the one procedure. I have strictly multi-layer treatment approach. Each layer of the skin has my approach in the way that you have to start with the energy-based devices, or sometimes even I like to analyze the aging in the deeper layer to understand when will be the next step of the aging to prevent. Then journey. You have to really get the trust of the patient to build this relation and to start to have consistency. I think this is so important because there is no one treatment, or the mix of the treatment can be done together. You have to really smartly improve each layer of the skin, because we know the skin has the study been done about skin intelligence. Skin will react with the bad or with the good answers, and we want good answers, but sometimes you have to be ready that the skin might not react. There's some treatment that really you implemented, and you have to be open and to find the solution in order to succeed and to get the best. As we are dermatologists, as I said, I like always to improve the quality of the skin, the highest level. As you mentioned, this is what I think everybody likes today, to have the nice radiant skin, glow, fresh look. I think more and more is awareness about healthy skin is in.
Yeah, that's so important. And speaking of like that natural glow or that red carpet glow, what is your approach? Especially, hearing from you, you like to, it's a process, right? And to get that result, it's not one thing, it's multiple things. Do you recommend for people, like say if they have a wedding coming up or an important event, when should they start coming to you or to their dermatologist to kind of get that process started so that way they can look really good for that special day? What's the time frame for each that you recommend in
I
general?
like always to say the rules of three, at least 3 months in advance, red carpet, or 3 months before, because we know the skin, you will need at least 3 months for the 3 cycles. And to treat the 3 layers of the skin, I like rules of three. You have to implement three different treatments, 3 different layers, 3 months. You need to have time frame to achieve what you want to achieve.
I love that.
Love that. Yeah. That's a
That's a
great,
good,
great rule.
yeah,
Yeah. And easy to
that's a good rule.
remember.
Yeah,
Yeah.
rule of threes.
hmm
All right. Well, I know one of the things that I'm sure is so important when it comes to being, a dermatologist in general, but is that building that trust with patients, and that relationship, I think is so important. I think that that's also what like kind of is part of that whole treatment process, is like is that patient trusting you and the patient believing in what you're doing. um there's a lot of fear out there around injectables because there's like crazy results, botched results.
hmm
What are your like non-negotiables when it comes to doing this work safely and ethically? What should listeners like look for before choosing an injector?
I always like to say experience. It will
Yeah,
be
yeah,
the
yeah.
first. And you have to really inject so many patients to get their own experience. And to get part of that is also anatomy, as I mentioned. And you have to be very knowledgeable. And I'm very passionate, and I like that we are dermatologists, because I think we know each part of the skin. We know exactly, we learn a lot about the skin, especially we know the best of pathology, pathophysiology, we know histology of the skin. To treat the skin with injectables is really need a very good background.
Yeah.
And today we are surrounded with new injectors, with the new skills. I think when you are in the beginning on this injector, let's say, career, you are brave. You are more brave to do more risky areas and more risky way of injections. Today, I will always say, if your question is how to find the proper injector, You have to look about experience and about specialty, and you have to follow social media. I built my career in the word of mouth. I think word of mouth is very important. Review of the doctors, and in the end, you have to uh, go by and to judge the doctor how strong will be consultation and how you will be your feeling during consultation, because I find there is a commercial aspect behind aesthetic medicine. What we have to always consider there is medicine first. There is no
Yep.
any commercial aspect in area where I'm practicing. There are many offers. There is more sailing tools like selling the treatments and the injectables, especially, and
Right.
the industry are sometimes pushing in these directions. And
Yeah.
I think the doctors has to have the very strong ethical approach to the patient talking about injectables. And
Yeah, I agree.
luckily today we have new products, anti-aging products. We have also beautiful skin boosters, polypeptides, many other alternatives that we can use the skin fillers only if there is really necessary.
Yeah. For new patients, maybe seeking cosmetic treatment for the first time, and they're just overwhelmed with all the products and maybe doctors, are there red flags that you can point them to be aware of when booking with someone for these treatments? Things that maybe patients should be aware of that are maybe like warnings that there may not be the most appropriate for that person.
Definitely, you have to. I think the patient always has to check, as I mentioned, specialty of the doctor, and experience is also important. Who is ever, in this industry more than 5 years, 10, even more, it means something. And you have to go by reviews, as I mentioned. You're practicing in US, I believe. There is very important reviews, and there is important
Yeah.
marketing skills. What the patient, when they look and searching and tools for the new doctors, they can compare and combine, and before to come to see the doctor. And the red flag for us doctors is always not to be injected. There are many products that maybe I will never consider even to touch and to try on me, and not even for the patients. We have to use the highest quality products. Everything is, scientifically proved, clinically proved, because there are now area we have a lot of products, many new
Yeah.
products.
Yeah, I think having that experience is so important. And I always tell my patients is want to make sure whoever is injecting you is someone you feel comfortable to, and the you like their artwork in that sense. It is definitely art, right? Cosmetics. And if you want to go with more of a natural look, but yet that maybe provider does more, kind of the results are a little bit different than what you want, then maybe that isn't the best treatment provider for you. But yeah, that experience is so important because a lot of things can go wrong. And sometimes I think this is where it's dangerous in the US too with the medical spas. Is like people are injecting, they don't actually know the dangers. So when you don't know, that is when really kind of things can go down the wrong path and the complications. I think it's, injection is easy to learn, but dealing with the complications or knowing what's dangerous, I think that's harder. Yeah,
Yeah,
like you
I
said.
totally agree.
Yeah, that's kind of what separates doctors from a lot of people who
Yeah.
just take a weekend course on how to inject filler, So speaking of complications or people just being unhappy going somewhere and they want to reverse what they had done, what is your take on dissolving filler? Like, when do you know when it's like right for the patient? Yeah, when would you consider it?
luckily we have Hilani days for this kind of
Right. Yeah.
situation.
Yes.
And knowing the protocol of Hilani days is very easy to implement. But again, there is a protocol how much you can use for patient, because sometimes you would like to dissolve everything, but not maybe in the one session, because you might also affect the natural hyaluronic acid in the skin. And I like to dissolve. I like to always start from the 0 point. But when you dissolve the fillers, you have to really respect the natural hyaluronic acid there. You cannot go with overdoses of the units of hyaluronidases. And I find more and more wrongly, as you mentioned, wrongly in injected patients in the different type of density of the fillers, in the different layer of the skin, then fillers migrate. And then you have to definitely advise the patient to dissolve.
Yeah. Yeah. I know. I think we were just talking about how there's a lot of people, at least, yeah, for sure in the US, who aren't doctors. And I think we were talking about the ethical implications. I think people are like selling fillers, like, and not thinking about the overall outcome, the potential of filler migration. And so I think we're seeing more people wanting to reverse some of these fillers that they get done at some of these places.
Yeah. And then a few more questions. For those who are not ready, say for fillers and Botox, especially, how do you advise them? Where should they focus on for, improving the aging more gracefully, if I may use that term? It sounds like you're a big proponent of also energy-based devices, but for those who are not interested in having any injection, what is your recommendation? And I think you mentioned already that skin quality, but maybe like your philosophy, or like what you would suggest for those individuals. Yeah.
As you mentioned, energy-based devices, including many lasers, IPL lasers. I think those people are really always those type of the patients, a category of patient. You said they're not ready for injectables. They're always ready to accept the advice using some of laser devices, of IPL laser device. It is really amazing. I can see such a good improvement only using them. And you don't need to use injectables if the patient will have the proper home care. Combination of the energy-based devices. Today we have, as I mentioned, artificial intelligence guided IPLs like BBL, Heroic. We're using in our practice here. It's a very powerful device, and I really have a beautiful outcome, especially when you design the skincare protocols of the patients. Then there is a lot of alternatives, and injectables are one of them, but it's not only. In this our power being dermatologist, we can use all of the other tools and skills. I'm a big lover of devices. I like to treat also a lot of underlying tissue we do also in our clinic muscle stimulation. I like to combine biophysics like ultrasound based devices with radio frequency devices, fractional microneedling. I like to combine. This why I think there is always alternative for those the patient. They are not keen to do any injectables.
Okay. And then we also know, skincare is also very important. It's a huge part, to me, sometimes I feel like if patients aren't doing skincare, they get all these like expensive procedures done, but they're not doing skincare. There's not really, they don't get as much benefit from doing all these procedures. So, from your perspective, what do you look at as a thoughtful, like anti-aging skincare routine? What does that look like to you? And are there any like non-negotiables that you recommend for people that they do, especially if they don't want to do, procedures? Is there anything that they really need to do with their skincare?
This, like as I said, it's like when you do the cake, you start with foundation, then you go by layer, but in the end, is the skincare is like this the superficial layer of the skin.
Yeah.
But luckily, we have today really fantastic skincare products in the market and scientifically proved. I always like to check about the science behind because it's for us dermatologists is so important and it's very powerful to have the skincare that is really proved. And I like always to advise the patient, as I mentioned, to use the skin protection. The sunscreen protection is the key, and the skin is very simple about our skin routine. There are products that is mandatory, although you don't need to have the range of the 12. As you can see now, new generation Gen Z, they have like sometimes they come to my office. They say, "Doctor, see, this is all my products," and they have like 12 products, the range. But as I mentioned, there is a new anti-aging implementing the skincare. I think we will have more and more of them in the market and controlling our genes expression and environmental damage on the skin is really something that is crucial, I think, for get the best effect. And they were talking about sunscreens. They have a lot of new sunscreen filters based on the corals and with the latest sustainability concept implemented. There are a lot of innovations and we are very open for that, and using and preparing the skincare routine for me is like piece of cake, really. I like that, and I'm really always like to give to my patient homework because it's something that we like to advise our patient, and I don't know any dermatologist who is not prescribing skincare to the patients with with no passion. We are very passionate about. I can see this how we also met, and I'm very happy that I can share with you my passion because skincare is crucial in our practice every day.
So lastly, if I may pick your brain, what category of skincare products that are like must-haves for yourself or for your patients? Like, you know, like you mentioned, we're all big proponents of vitamin C. I love it. Mamina, I love it. I'm sure you do as well. Like retinoids, exfoliants. What do you like just commonly recommend for your patients to have in their routine to use either to cycle or to use regularly to really achieve that beautiful quality that we've been talking about?
Everything, as you mentioned, good moisturizer, sun protection, very good cleanser. I think it's also important to retinol, new peptide-based products like Hexi and deep peptide, new products in the market. And I think this the skin is very simple, and if you if you have those we mentioned, you are already complete. You have everything, and then the rest is depends on the skin condition. In our area, we have we have a lot of demand for the products for the skin pigmentations. We have really a lot of challenges for melasma, for post-inflammatory pigmentation, and this then you design for protocol according with the skin condition and skin damage.
Yeah, that makes sense. Yeah, that was, I think those are our questions. I mean, I have so many more questions I want to ask you, but for the sake of time, we're gonna finish up here. But yeah, that was such an informative, insightful conversation. We covered a lot. We grilled you, so thank you for like answering a lot of questions. Hopefully, we gave you a new way to think about aging skincare and what actually matters when it comes to your face, thanks to Dr. Lukian's perspective.
Yeah, and Dr. Lukian, for our listeners and followers, where can they find more about what you do and your amazing platform, your beautiful clinic that Mamina one day and I were wanting to visit?
Yeah, we're going to come visit.
Yeah, tell our listeners where they can find more of you and learn more about you.
As you know, I'm based in Dubai, and clinic name is Lucia. And luce is a light. We talk about laser devices and the old Latin language. I learned in my medicine university. Luce does mean light. We are using light devices in the hands, like laser light, infrared light, LED light, a lot of light devices to improve the quality of the skin. And Lucia Clinic is in the heart of Dubai. I really wish you will come to visit me soon. And I think my patients and my audience can find me also my social platforms. And I'm really open to answer any question. And I really like to share my tips and tricks if there is any. And I'm very open to share everything with everyone, because I think this is our rules. Dermatologists really has to be trendsetters. We are the very powerful in the aesthetic industry, and I think our voice is very important, because education is behind us, and this is what we want to spread around us, awareness. What we do and how to properly take care about health of our skin.
For sure.
Yes, thank you. Yes, we'll make sure to link your Instagram. Yeah, I know you're active on there, so we'll make sure to link that in the show notes.
Yeah. Thank you so much for your time. Yeah, we know you're so busy. Really appreciate all the insights.
It's the end of the working day in Dubai.
Oh, that's right. I know you're 9 hours ahead of us here. We're in Central Time, so yes.
Nice to be with you, and hopefully to see you soon in Dubai.
Yes.
Thank you again.
Yes, thank you so much. And of course, if you love this episode, be sure to subscribe to the show so you don't miss anything, especially upcoming episodes. We seriously appreciate it if you could leave us a quick review. It really helps us grow. And don't forget to follow us on Instagram at the Skin Deep Podcast, as well as subscribe to our YouTube channel for bonus content, skincare tips, and expert takes.
Thank you so much for listening, and we'll see you next week on Skin Deep and Unfiltered.
Bye.
Bye.